on this episode of A Tale of Two Hygienists.
Patient uses this system of dental monitoring to scan their teeth, so our doctors are watching their progress. Now, in addition to us, the treating doctor can watch them as well because they have access to their account on dental monitoring. So together, we're watching the progress of those aligners. What does that mean? That means there's multiple eyes watching progress, seeing if there's something that broke, seeing if there's something that needs work on, whether it be hygiene or just congratulatory, high fives on great progress. Hygienists see the patients every visit. They are the they're the connectors, I like to say. I think they're the gatekeeper of all the professions, whether it be dentistry, orthodontics, or any of the specialties, because they're the ones the patients see. So that's kind of where we created our system, is really honed in for them, because they're the ones that see the patient. So if they see crowding, if they see spacing, if they see some type of occlusal wear, or the patient reports headaches or TMJ, these are all great candidates for clear aligners.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 495. I'm your host, Andrew Johnston, and thank you so much for being with us today. In this episode, Dr. Ilan Abramowitz spends time with me talking about this evolution I've seen in my career. And I think many of you can probably join me in this kind of observation that I had. But early in my career, and especially going through school, we talked a lot about traditional ortho, right? The wires, the brackets, the cements, all of those kinds of things. And then shortly thereafter, clear aligners became more and more popular, but kind of niche-y, and the case selection for them was very specific. Fast forward now 10, 15 years later, it seems like clear aligner therapy is all the rage. And while I don't have the numbers on it, it feels like more of our patients are opting into that than they're opting for traditional ortho. And I think a large part of that is because in many offices, the offices are actually offering bonuses to their hygienists, their dental assistants, all of them, when they get the case acceptance from the patients. And so in this episode, we talk about why clear aligner therapy practices, historically, sometimes why they have failed, and then what it takes to have a successful case now. We talk a lot about home care and compliance. We talk about retainers, how long you're supposed to use them, what kind of retainers you should have, all of that and more. And while it might feel like it's somewhat out of our lane as RDHs, the end result for the patients is health, or at least optimally it is health. And so I think it's really something that we need to focus on a little bit more. I think adding this one little touch to get our patients healthier is really important. In other news, RDH Under One Roof is coming up next week in Dallas, and we have a podcast booth there again. It will be as you walk into the exhibit hall floor in the back left-hand corner. Feel free to stop by and wave. If I'm not in an interview, let's have a conversation. Stop by and say hello. Let's say hi. We will also have the DSO leadership course, similar to the DSO panels that we've had in the past, on Sunday morning. So if you're feeling like you want to know about different leadership opportunities that exist and what it takes to get them, it's Sunday morning, July 20th at 7:30 a.m. We have a great group of leaders from the various DSOs. Misty Mattingly and Trish Keenan are coming back again this year, and they'll be joined by Raphael Rondon, Andrea Edelin, and Lindsay Mitchell. The format for this is just a little bit different, where each of them are only going to take about 20 minutes and speak very specifically about a job title and its responsibilities. And so it's a career pathway. We're going to start with mentors and area coordinators and work all the way up to VP and Chief of Hygiene. And then after their remarks, we'll have the opportunity to meet with them and many other DSO leaders from all around the U.S. and ask them very specific questions in a speed dating type format. This will give you the opportunity to hear what the different DSOs have to say about how they practice and what they believe in. It'll also give you an opportunity to ask the speakers to clarify certain points that they made from the podium. It's going to be great. So make sure you grab your coffee. It's an early class and come join us there. Thank you so much for listening. I think that's all for this week. So enjoy this episode with Dr. Ilan Abramowitz.
A tale of two hygienists.
Listeners, welcome into this interview portion of the podcast. I'm really excited today because we're revisiting a topic that we haven't talked about in like probably several years. So we have Dr. Ilan Abramowitz. Thank you for being on today.
Thank you for having me, Andrew.
So first of all, do you mind just giving our audience, I know it's like the easiest podcasting question you could ever ask, but just who are you? Like, what's your background before we kind of dive into some of the deeper questions?
Sounds great. Dr. Ilan Abramowitz. I am an orthodontist. Been practicing for 20 years. And I've kind of sold my offices and created Perfect Fit Orthodontics, which is a clear aligner orthodontic consulting system. And it was created, I'd say about 2017, 18, when I started to see this clear aligner revolution come on that was going direct to consumer. And the challenge with direct to consumer is you're missing the oversight of a professional. And I saw a lot of things happening. I even tested one of the big companies on myself. And I said, we can do better than this for the community and for our population and for our friends. So that's kind of where I began the journey of Perfect Fit Orthodontics.
Okay, let's jump right into this, because I feel like on the social medias and stuff, when we're talking about these, well, we don't get sued, so we won't say any names, but like the direct to consumer products that were out there, the hygiene community hated those. Like historically, like we saw so many train wrecks that kind of happened because of it. What was the failure other than the oversight part? Like what was like the real failure there? Why can't that model work necessarily?
Well, that's a great question. So that model can't work because number one, there's really no oversight, like we already touched on. But number two, it's missing some key components. Number one, it's missing someone that's watching it on whether it be weekly, monthly, however it's done. And the second thing is, I like to say the teeth aren't treated with what's called attachments. And that kind of limits things. So I know a lot of people that get aligners hate attachments. They were hoping not to have anything on their teeth. But an attachment is kind of like a handlebar to kind of move the teeth where you want them to go. Without a handlebar, it's kind of like using braces without a bracket.
Can we talk a little bit about kind of like the traditional braces system versus clear aligner system?
Absolutely.
Yeah, I mean, there's pros and cons to both, right? So like where are we at with that?
Okay, so in my view, it's quite a bit different. I like to say I'm divergent, and I like to study from people that other people question. When it's something new, I say I want to learn about that. When people question it, I say that it's my time to study that. So I did that, and I learned from some great mentors how to treat cases with braces. And through that, I was able to meet people that learned how to do it with aligners. So I was blessed to get to talk to some orthodontists from other countries, particularly Asia, that were showing me cases that they treat with aligners. And the most amazing thing was when I learned from them and tinkered with them, and what I learned from orthodontics, I too was able to treat any case with clear aligners. So if I could do it with braces, I could do it with clear aligners. And the funniest thing is the only thing it requires is full patient cooperation. I'd always say, if you can wear these aligners, we can do everything. But the key is you have to wear them. And what's the difference? Braces are glued on your teeth. You can't forget. Aligners, they're not. So as long as we get 100% cooperation, things are magic. Now, the difference between aligners and braces, aligners are preset. So I always found them to be faster, more comfortable, easier for hygienists to clean the teeth, and easier for patients to clean the teeth because there's no wires and brackets that they have to thread floss through. It's just take off the aligners, floss freely, brush freely, and put them back in.
I do want to come back in a little bit to talk about the compliance issues and home care and maintenance and all that kind of stuff. So I think it's a really key component to all of this. But I want to circle back to what you just said about, so we had clear aligner therapy already here in any other place in the States and things like that. But then you found, was it just the material difference? Like what is different to what they were doing in Asia that you learned about? Is it technique, or is it actual material, or is it combination? How are they doing it so much different before?
It was technique. They were showing me their techniques, and their techniques, it made sense when you saw it. It was kind of similar to techniques I used with braces, which was a little different than what I learned in school. And it just worked. And again, we just get back to the compliance. So here's what the aligners do that braces don't. I control the teeth through setup. So when I get the feedback from the companies, I would adjust it. So I knew how to move the teeth in a way that was very controlling to get the results we wanted to get, depending on the case.
Interesting. I'm interested in, well, we talked about this kind of a little bit before we started, but right now the dental hygiene community kind of feels like we're having some, I don't want to say turf wars. That's maybe not the right term maybe, but there's some crossover in scope of practices. And I feel like one of the things that you all do really well is you work with like the general practices, the general dentists. Tell me about like education needs for maybe like the general dentist trying to get into the clear aligner space or in any orthodontics.
That's a great question. So for the dentist, getting into the orthodontic space, it's really not difficult, especially in the US, because they kind of are allowed to with most of their state licensures. The trick is, I've been doing it for 20 years and I'm still learning pretty much. I won't say every case, but every few months I'll see something cool and a new trick. 20 years. So I didn't take a weekend course. I like to say, I didn't stay at a Holiday Inn. So I like to say there's some cases that are pretty easy to do with clear aligners. Most cases are kind of routine, but really, if you really want to do it right, I think, you can refer it to the orthodontist. Or nowadays, we've got my company, which is here to be the orthodontic consultant. So that kind of lets you know that if you're willing to go in with an orthodontic consultant from beginning to end, you can pretty much handle any case because I can. And I'm here to be with you from beginning till end.
Can I pick at that just a little bit and just
Sure.
cover some things? Because again, this is a whole new space for me. And I'm sorry that this is a little bit low hanging fruit for you, but what is it exactly that you do different than, say, other big clear aligner company that has programs and, supposedly people that are on the other side that can help us do the things as well? Like what do you do differently for them?
Sure. So what we do different is we're pretty much with you from start all the way through treatment to finish. A lot of the other aligner companies, consulting firms, they'll do things a little different than we do. So what I created is something that, we're here to help you with the exam. Within 15 minutes, you come through the app that we create for you, and you will have an orthodontist review that case and give you an estimated treatment time within 15 minutes. Second thing we've done is prior to starting on your app, we've created some financial options for you. Finances is one of the big things in the economy today. Well, we know that. And so we've created some third-party financing. We have set programs for you that if you want to instill in-office financing. And again, that's directly from that widget. That's preset. So again, after that 15-minute consult exam, you actually have that treatment plan to present to them with options to pay for affordability. After that, once the scan and submission is taken and submitted to us and we get that prescription, we will create that treatment plan that you wanted. We will work with that lab of the aligner to get the results that we feel you requested. Then we send it back to you. Obviously, you're the licensed doctor, so the licensed doctor will approve it. And then they'll set up a system that we use through something called dental monitoring, which lets us monitor the case from start to finish. The patient uses this system of dental monitoring to scan their teeth. So our doctors are watching their progress. Now, in addition to us, the treating doctor can watch them as well because they have access to their account on dental monitoring. So together, we're watching the progress of those aligners. What does that mean? That means there's multiple eyes watching progress, seeing if there's something that broke, seeing if there's something that needs work on, whether it be hygiene or just congratulatory, high fives on great progress. Then when treatment's done, we're there to help you figure out if anything else needs to be done or it's time to order retainers. So I think if you look at it, we're really the only company that's there from beginning, exam, treatment planning, progress of treatment, all the way till the end.
Tell me more about this scanning part, because when I hear scans, I'm thinking more like radiographs and that kind of stuff. Yeah, me some patients are doing it at home.
Yeah, so it's on an app, it's a phone, and it's photos. It's photos. Actually, it's a video. That's why it's a scan. And there's about 3 sets of scans, which are pretty much videos of the teeth. And it's done through a phone, through that app that we help download onto that phone.
Try and draw the picture for me in my head. So I'm looking at this patient that might be holding their phone into their mouth somehow. Like, what kind of guidance are they given?
Okay, so there's a retractor, and attached to that retractor for the cheeks is a way to mount your phone. So now imagine you clip your phone on this mount, which connects to these cheek retractors. You put the retractors in your mouth, and then there's going to be verbal and video instructions that you can watch in a mirror that tell you, okay, moves, it tells you where your aligner, open your bite a little bit, scan to the right, now go to the left. Take out and then go, and it says open your mouth wide, go up, go all the way down, and then it'll say take your aligner off, bite down all the way, scan to the right, scan to the left, and it kind of walks through the whole thing. It's about 1 minute and 30 seconds. And it's the best office visit anyone could ever ask for, because you can do it any time of the day, anywhere in the world, as long as you have Wi-Fi connection.
But the cheeker trackers are the ticket, I think, on that one. I can now envision, like, keeping it wide open. I was like, that's a lot of time. Let's get into compliance. I feel like when we say compliance, we're thinking more like, home care maintenance, that kind of stuff. What kind of compliance are you talking about when patient is important?
They got to wear those aligners, right? Just like they got to keep that oral hygiene. They got to floss, got to brush, got to wear your aligner. My favorite analogy is aligners are clothing for your teeth. Just like us, we only are naked when we shower. So keep your teeth naked while you brush. Other than that, keep them wearing those clothes. So that's kind of the joke I give them. But you got to wear the aligners 22 hours a day. Some companies say less, but honestly, if you go less than 16, you're just going to lose traction. You're just going to lose traction. So I'd say at least 16 hours a day, you've got to wear those aligners. Just like you're going to wear clothes when you go out, keep wearing them. Because without them, the teeth can go back to where they started.
Right. How do you prevent caries and things like that from happening when the teeth are just encapsulated for so long?
Well, the beautiful thing is they're under the care of an orthodontist and a dentist who's monitoring them. But obviously, we go over the instructions. You got to brush after every meal. You got to floss. I recommend it after every meal as well. So I used to call it, the clear aligner diet, because when I tested clear aligners on myself, I would brush my teeth and floss 6 times a day. I got it down to 6 times a day. So what that meant is I restricted my meals. I had my set pattern. If someone offered me something outside of that pattern, with breakfast, snack, lunch, snack, dinner, bedtime, that was it. If it was something outside of that, I couldn't eat it. Wonderful side diet.
Okay, that's good. Wait, what's the typical case span look like? How long?
So as our clients get comfortable, they start doing more challenging cases. So our average is actually 15 months, which is it's not the easiest of cases, but we kind of make it easy because we're monitoring it virtually with the doctor. And so in this 15 months, the part that the doctors love is the patients literally coming in their office maybe twice, once to start, once to finish. And that's one thing that, that really has been abundant in what we've created is these clients, these dentists are able to save chair time. So they could do whatever they choose to do inside their office and kind of delegate the orthodontist treatment to an orthodontist who's kind of consulting them the whole way through.
You mentioned retainers earlier, and I think that there has to be some virtue of a fixed retainer. There's got to be some virtue of a removable retainer. Where you land on kind of like that debate, and kind of what are the pros of each? That's
a great question. So I've been through all of them. I've tried so many over the 20 years. At this moment with technology, I am all in on the removable clear aligner retainers. And the reason I am is because, number one, anything bonded makes it very tough to brush and floss, especially behind the teeth, specifically the lowers. Those linguals are tough. So I'm not a fan of those. I've seen calculus build up. I see some that break off way too often because nothing is permanent. People call them permanent retainers. I say there's nothing permanent about retention, except you need to keep wearing one. So I am a fan of the clear aligners for the hygiene reasons. And because, the wire retainers, the Hollies, the ones we used to use, I don't think they cover enough of the teeth to support ideal retention, which the clear aligners do as long as they're worn. So that's where I'm a fan of clear aligner retainers.
Is there, I remember growing up, they always say, yeah, you wear the retainer for 3 years. Like, you wear the retainer for 10 years, do this stuff. Is there an ideal amount of time now, or our teeth are always going to want to relapse at some point?
You made both statements. The ideal amount of time, I like to say, is as long as you want to keep those teeth straight. I wouldn't say forever, just as long as you want to keep them straight. Once you've worn it for a while, you can get it down to about 12 hours a day, maybe 12 hours every other day. But yeah, it's just like our diet with nutrition. If you break that nutrition, things start to happen. If you don't wear retainers, your teeth are going to move. Research has shown they're going to move over time anyway, because once we're done growing, I like to say we do start shrinking slowly but surely, and at least the bone does. So that's going to cause shifting of the teeth. So yeah.
It was not necessarily relapsing to its original place. It might just be kind of just moving just anywhere at this point where the shrinkage.
You know what? It could be, the research shows that, there is relapse to the original, but I haven't really seen much on what's the relapse location of long-term retainer wear. I haven't seen any studies on that. but I have seen crowding over extended periods of time. So no matter where they started, for example, myself, I had teeth pulled out way back in the old days, and I had a little bit of crowding that I had to fix. So even when I had 4 teeth pulled out, I still were getting crowding when I didn't wear my retainer.
I was just going to actually ask you, that's on my list of things that, where it's more wisdom teeth, right? Wisdom teeth is what pushes forward and crowds and all this stuff. And I think that's been a rebuff. I think in the dental community, I think we are pretty much handling that really well now. But where do you stand on removal of, premolars or whatever for getting space?
After studying a lot from with those doctors in Asia, Europe, and looking into sleep and airway, I am totally against extraction of any teeth. I've really been able to hunker down on that. And in orthodontics, I can treat any case without extraction. Every now and then, though, the options to do that are a little too much for a patient to handle, might take longer. So that's the only time I'll extract a teeth is if they insist on it and like the teeth are completely blocked out. But other than that, I choose to make room and just expand, and that way it opens up their airway.
Are there any, is there any truth to having your thirds removed, or the necessity for having your thirds removed? Not for caries reasons or for perio reasons, but just for orthodontic reasons?
I don't believe so. So I stopped referring any of my patients out for wisdom tooth extraction unless there's been some severe decay there or it's really bothering them. I usually tell them, worst case scenario, you have backup molars for, someday 20, 30, 40, 50 years from now if you need a tooth pulled out because there's a bad cavity or something.
I love it. What question did I not ask that you wish I would have asked?
Well, the question I'd love to go into is let's talk about your listeners and the hygienists and the role that they can play in kind of the service we have with clear aligners, because I think they're really a key part in this, especially for the well-being of the patients. Hygienists see the patients every visit. They are they're the connectors, I like to say. I think they're the gatekeeper of all the professions, whether it be dentistry, orthodontics, and any of the specialties, because they're the ones that patients see. So that's kind of where we created our system is really honed in for them, because they're the ones that see the patient. So if they see crowding, if they see spacing, if they see some type of occlusal wear or the patient reports or headaches or TMJ, these are all great candidates for clear aligners, because clear aligners are i.e. tooth alignment, and that would really help those patients. And so the question I like to pose is all hygienists should look at that and say, have you ever thought about straightening those teeth? Have you ever thought about closing those gaps? Do you have headaches? Would you like to correct that with clear aligners? I mean, just ask the question and then pause. You never know what those wonderful people would tell them.
It's interesting too, because I think, hygienists by and large, like we're here for our patients. We really love to, like, we're servants, right? But at the end of the day, we have to kind of serve ourselves a little bit too. And I think having straighter, easier to maintain dentition is better for us and like our ergonomics and our long-term health for treating our patients and things like that too. So I know it kind of sounds weird to be selfish that way, like that, but I think hygienists need to kind of shift their perspective a little bit so that they are serving their patient that's going to serve themselves as well. So I'm so happy that you're on. I really appreciate you being here. I think that maybe you can come on again. We can do a little bit deeper dive into some science stuff, if that's all right with you. The forces of teeth are just so fascinating to me, and maybe touch on airway and things like that. But if anyone wanted to learn more, if you have learning resources, things like that, where can they go find that?
You can come onto our website, perfectfitortho.com. We've got links for videos, we've got links for lessons, and we host a bunch of webinars. So it's a great opportunity to come in. They're free. I look forward to teaching, and I think I could help you change the lives of your patients, and I look forward to it.
Appreciate it. Thanks so much, Doctor.
Thanks, Andrew. Appreciate it.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.